I don't even know. Can we say these words on the podcast? Like vagina and...
Sure.
We just talked about butts for half an hour. I think
That's true.
we're okay. Normally, at baseline, every woman has discharge. I don't think that's a well-known fact out there. The 10 things I'm too embarrassed to ask my OB. Is my vaginal odor normal? I wish men had to go through something, right? Because men don't go through...
Yeah, we do have...
They even took away rectal exams now,
Yes, I'm
like,
very, very happy about that.
Can we give you something? We get mammograms, our boobs get squeezed.
Yeah,
we have
true.
vaginal exams. That's not fun. It's like a thing that they donkey punch each other. Why do they call it donkey? I don't even know.
Why?
I don't know. I have no idea. Hello again, and welcome to our podcast from the inside out. Dr. Nakasone is here. We are going to talk about a very interesting subject today.
So today, our how should I say, our spotlight will actually be Dr. Lehua Perry, who's going to talk to us about the top 10.
Well,
the top.
I'm going to kind of first go into it. We're going to talk about some what I call the self-cleaning oven. And then we're going to move into some questions that people have, the top 10 questions that I'm too afraid to ask my OB.
Okay. Or too embarrassed to ask my OB.
Yeah, too embarrassed.
Okay. This is, I'm going to be all ears because I have obviously no idea.
But jump in anytime. This is very like a chill topic.
Yes.
But super important because I'm talking about vaginitis today.
Okay. And can you tell everyone what vaginitis is?
I don't even know. Can we say these words on the podcast? Like vagina and
sure.
You can't. Okay.
These are
I was just
medical
wondering,
terms.
right?
Yeah.
But I'm like wondering what the thing is.
If we get whatever, I guess.
Do we get like censored?
I have no idea.
I don't either.
Yeah.
No. Okay.
But they will let us know.
I mean, we just talked about butts for half an hour. I think
That's true.
we're okay.
But I think these are all medical issues.
They really are.
They're not bad words or anything.
Not at all.
These are true words.
They are, and the words everybody should be using.
Yeah. So for the audience, what is vaginitis?
Vaginitis. Okay, so this is something that I see. It's probably my most common reason for coming in. I see this. Maybe I would say like it's about 50% of my day usually is just vaginitis. So I call the vagina a self-cleaning oven, okay? We'll start with what is vaginal discharge, okay? Because basically we're talking about discharge. I know, gross, sorry, but it's not gross at all. But
what is vaginitis?
Okay, well, I'll go with vaginal discharge first, and then we'll go with vaginitis.
Okay.
So vaginal discharge is like a fluid that's kind of made by the cervix and the glands of the vagina.
Okay.
And basically, every woman has discharge.
Okay.
Men out there, it's not gross, it's not weird. Every woman has discharge.
Okay.
And you're supposed to have discharge because it's normal. Okay. So normally at baseline, every woman has discharge. I don't think that's a well-known fact out there. I don't know, right?
And I'm sure it varies in terms of...
There's a very large range in what is considered normal as far as discharge is concerned.
Some people could be drier.
Correct.
Some people could be way more...
Correct. So it varies
discharge-ish.
between a person to person.
Okay.
So it's either you can have a watery discharge, you can have a thicker discharge, it can be pasty or like thick depending on hormonal changes.
Okay.
Usually it's kind of like a whitish kind of color. That's fine. It removes dead cells, it removes bacteria, it provides moisture, and it maintains like a very balanced environment in the vagina. So we like discharge. But I guess it's not a well-known fact that you're kind of supposed to have it.
Okay.
So what is vaginitis? Okay, so vaginitis is like an abnormal discharge. So it's inflammation or infection of the vagina associated with symptoms like itching or burning, dyspareunia, which means painful intercourse. A lot of times it will have an odor that's not your natural odor, so it's very fishy in nature.
I think for the audience, anything that ends with itis, vaginitis, usually refers to some kind of inflammation. So,
Yeah, we don't like the itis.
yeah. Iritis is inflammation of your iris.
Iris.
Yeah.
Iritis.
Yeah. But there's no such thing as penisitis.
Penitis.
Yeah. As far as I know, there's
sure there is.
No, I'm sure there is.
sure
But
there is penitis.
That's not the problem.
Penitis. Yeah. Anyway. So yeah, this is one of the most frequent things that I see, reasons for a visit. So basically, we're just going to talk about symptoms, diagnosis, and like how we treat vaginitis, okay? And this is for, just a disclaimer, this is for non-pregnant people and people without HIV, because both of those things change the treatment of vaginitis.
Wait, sorry, say that again?
Pregnant people
Okay.
and HIV,
Okay.
those things change the way we treat vaginitis.
Why is that? Why?
Well, when
why?
you're pregnant, we can't use the same medications. Not necessarily. Sometimes we can.
And this is
And then
just
HIV too.
And this is mostly to protect the baby. Is that why?
Yeah, well, we need to treat it. We can
Yes.
treat it, but we just have to treat it in a different way. So this, what I'm talking about, is just non-pregnant individuals
Okay. And-
and non-immunocompromised individuals.
Okay. What's I don't know enough about the HIV and vaginitis relation. Like what's
Oh, it's a different treatment again. It's a different treatment
okay.
because they're immunocompromised
Got it.
heavily, right? So
Yeah.
it's just a different treatment. So this is just like the normal
Okay.
Sally Joe that comes in.
Okay.
Yeah. Okay, so
We're not picking on Sally Jo.
oh, I'm sorry. I didn't know. I just picked any name out of a hat. I'm sorry, Sally. I was gonna say Joe Schmo, but that's not a woman.
Yes.
You know, so can I use Joe Schmo?
True.
Sorry. Okay. No Sally Joe. Anyway, there are the three most common things that we talk about when we talk about vaginitis, okay? One is bacterial vaginitis.
Okay.
That's the most common. The second is like a yeast infection that causes vaginitis. And then also the third most common reason is trichomoniasis. So we call it trick.
Okay.
Okay, so
I'm really trying hard not to have
I'm
any
sorry.
funny names, but I will try to remain as professional as possible.
yeah.
Yeah.
So, we talk about estrogen being very important to the vagina.
Okay.
Estrogen is very crucial in keeping the vagina very happy.
Okay.
So usually you'll see all of these vaginitis kind of things coming up in the reproductive years because we have a lot of estrogen there.
Okay.
But it helps to keep like the flora and the bacteria all happy. Okay. And then our vagina is at a pH of less than 4.5 usually.
Okay.
Did you know our pH? We have a vaginal pH that our vagina is happy
I
at.
remember learning about this at one time.
Yes. So, it keeps, estrogen helps to just keep the vagina very happy.
Okay.
And have the good bacteria kind of flourishing.
Okay.
Okay. And so and keeping the vagina in a very acidic environment. So like bad things can't grow as
Okay.
much. So you won't find vaginitis that much. It's rare, but you do see it, but not as often as like a reproductive years. But you can see it in the younger girls and the really old ladies, but older ladies.
I think also just for the audience, a normal or a neutral pH
Yes.
is 7.
Yes.
Okay. So just so that the audience knows, 7 is like neutral.
Yes.
Right? I don't know if for those of you
Oh, thank you for explaining this.
have never taken chemistry or anything like that, but 7 is neutral.
Yep.
If you go higher
Higher.
than 7, it becomes more
Basic.
basic, okay, or alkaline. So for those of you who have bought water from Costco, for example,
Yeah.
a new fad or what rage is you buy alkaline water. So you notice that the water's pH at Costco
like
or
8 or 9,
wherever you're buying it is
right?
about 9.
9, yeah.
Okay, so that would be basic. So anything below 7 is more acidic. So a 4.5 is actually quite acidic.
It kind of is thinking
Yeah.
about that, right? Like
That's
on the pH scale.
I'm surprised that doesn't burn people.
I mean, it's not to that point.
Yeah, it's not to that
like
point, but-
vinegar is like a what? Maybe like a 1 or something. I don't know.
I don't know, but I'm actually surprised at how low that is.
It's a very low
Yeah.
acidic environment, but
Yeah.
for a purpose because,
Yeah,
certain
that
good
makes sense.
bacteria thrives there. And then in acidic environments, you don't get as much bacterial growth, right?
Yeah.
If you think about it. So, yeah. So we'll talk about the big bad BV. So this is bacterial vaginosis.
Okay.
It's the number one reason why we would have vaginitis. It's the most common cause of abnormal discharge.
And did you say that this takes up 50% of your, maybe
I would
almost
say
30
like
to 40%?
I would say 30, 40
of
my visits.
Okay.
Yeah, people always come in, which is great. We want people to come in if you have a different sort of discharge, if it's smelly, if it's stinky, if it's itchy. You know, women are very in tune with their bodies. And so when something's off, and it can be really uncomfortable. Okay.
But that high.
Yeah.
This makes me very happy that I'm in orthopedics.
Oh,
thank you.
Really?
Yes.
I don't know. I don't know if I could do what you do.
Yeah,
I love what I do.
I don't. Yeah. See, and that's why people pick different specialties.
That is
right?
true.
They say that
true.
in. We were just talking about this. OBGYN is probably like 75 to 80% female.
Yes.
Orthopedics is probably the opposite way.
Opposite, right?
With a low women. You know, like
That's
we're actually
true.
trying to get more.
Do you guys
women
have a
into ortho.
percentage? Like how many
It's
women?
pretty low though. I
Yeah.
can't imagine. I would imagine it's like engineering. Engineering
Yeah.
schools like at Caltech, and at least when I was there, it was
Yeah.
like a 6-to-1 boy to girl ratio.
Wow.
Right? Just because girls generally they don't go into certain specialties.
Yeah.
It's just the
Well,
way
that
it
one's
is.
very physical. You're especially super physical. And
Yeah,
like,
but we've been trying to get more.
also the
women now.
engineering mind is very difficult
I think
for
people,
me.
you know, people just everybody gravitates to a different specialty
true.
depending on what they're
Like,
interested
I'm not
in.
good with math and physics. Like, it's
I
not
would
my
not.
jam.
I would not be good with vaginitis.
Yeah. So we're in the perfect fields for ourselves.
Yes.
So people come in.
Yeah.
The most common kind of symptoms that people come in with bacterial vaginosis, or we call it BV, people will come in saying, hey, doc, I have a different sort of discharge. It's very watery, thin, kind of grayish sometimes. And the most common thing I hear is it smells like fish. So it's like a fishy, stinky discharge, okay? That is usually BV right off the bat.
Okay.
We can diagnose it in many different ways. Some do still old school where we do a swab and then we put it on a microscope and we look at it in the office and we're looking for certain cells. But most times nowadays we just do a little swab, send it off. But you can kind of tell just on the exam the type of discharge and if there's like a malodorous discharge, and you can just kind of tell. But that's how we diagnose it. And then we can treat it with some oral metronidazole, or you can do some inserts, and you can do that for a few days.
Sorry, what are the inserts just for people who?
They're metronidazole inserts.
Meaning like you put the pill into the vagina.
So it's like a suppository.
Oh, okay.
Yeah.
But into the vagina. Right?
Yep.
Yeah.
All the way up there.
Yeah, just to make sure, because some people, when they hear suppository, they might think that they
Butt.
stick the pill in their butt and that will cure their vagina.
So there's rectal suppositories and then there's vaginal
So
suppositories.
just that's. I think we should be clear about.
Yes,
that. Yeah.
thank you. So there are some people though that you treat BV and then it just keeps coming back.
Okay. And how does this happen?
Oh yeah, so BV, sorry, it's not a true infection, but it's a change in the normal microbiome like we were talking about.
Oh, so then there's an imbalance of
there's
one
correct.
bacteria that overpopulates.
Overgrowth.
Compared to the other.
Yes,
Yeah. So
yes.
there's a normal flora.
Yes, there's a normal
that
flora.
every woman has.
That certain things can change that
Sure.
flora, right?
But whatever it is, say the pH goes off for a little bit or whatever,
Yes.
and one bacteria becomes dominant.
Yes.
When they should be all living in harmony.
Yes.
Got it.
We are not in harmony.
Got it.
Yep. So this one is not a true infection, but it's just a little overgrowth, you know?
Do you happen to know? I'm just curious. Like, what's like the top 3, I don't know, types of bacteria that live in the female?
Oh, we have tons though.
Okay,
We have like
So it really
I don't
doesn't.
know the specific name of it. There's like lactobacilli, blah blah blah.
Okay, so lactobacillus is the one that I remember,
yeah,
right?
yeah.
Yeah.
There's all these different.
But different
I don't
types
know
of
the top,
bacteria.
like the top bacteria,
Yeah.
but
I'm
there's
guessing it's
tons
different
of
for different
lactobacilli.
women, right?
Yes, yes.
Which is really interesting. when you
It's
think
super
about it.
interesting because there's a lot of good bacteria that we
Yeah.
think of bacteria, we think bad.
Yeah.
But in the vagina and the gut, good, right? Because
Yes.
they both
Yes.
kind of help with keeping everything really
Yes.
nice and the balance correct. Yeah. Yeah. So sometimes we treat the BV and it keeps coming back.
Okay.
So there are some things that we can treat as far as like what we call suppressive therapy. So if you have like 3 or more episodes a year, we can give you those inserts kind of twice weekly for a good 16-ish weeks, and then we can kind of see it kind of saves off any more infections.
And these inserts, are they more? They're not antibacterials. Are they just sort of more?
It's a metronidazole, you know.
So
it's not an antibiotic.
it's
but
not,
it's
right?
Yeah, it's
Does it help sort of restore the normal pH?
It
if
kind
you
of
will?
does. It does.
So that
It
the
kind of
body
does.
will sort of get back to its normal.
Back to its normal. Mm-hmm.
I see. Oh, interesting.
But they've done studies. I recommend it usually, but they've done studies which didn't show any kind of improvement. But on like probiotics,
Okay.
taking like a vaginal probiotic
Okay.
to help restore the good bacteria and the pH and everything down there. But all the evidence-based studies don't show
That they make a difference.
that they really make a difference. But I find like the people with recurrent BV, if they take a probiotic, there's really no harm in it. Again, this is not medical advice, but there's really no harm in taking the probiotic. So, if that's something that you struggle with, having recurrent vaginitis,
And this probiotic is an ingestible form?
you
or-
can have a pill. There's pills.
okay.
Or you can eat things like yogurt with active cultures, like the Activa. That's
Yeah.
special. Yeah.
Really?
Yeah.
Okay.
Like
That's interesting.
active culture yogurts really help with all of the.
Really?
Mm-hmm.
Okay. I thought that was more of I thought that was limited to more of gut stuff, but
There's a gut one, and then there's actually, if I tell my patients, you have to look for something called like vaginal probiotics.
Oh, really?
So it says either vaginal health or women's health.
Yeah.
Those are specific to the vagina.
wow.
So I tell my patients to look for something called that women's health or vaginal health on the bottle, and make sure that it's specific to the vagina's
And you
flora.
can find this in like Safeway or Food Line or whatever?
Yeah, usually more of the health food stores, but a lot of
okay.
my patients get it on Amazon.
Oh, okay.
Yeah.
Wow, I didn't even know that.
Yeah.
Something
And there's
specific to that.
different numbers. There's like millions or billions. Usually
Like,
they
yeah,
go
like-
for the higher
got it,
number
got it.
of things. But, only recurrent kind of stuff I tell them.
Yeah.
Maybe it's a good idea. Or eat some more yogurt, get that good bacteria in there naturally too. Yeah. There's a new recommendation with BV though. So
Okay.
when we found out that people keep getting BV amongst each other, well, they found that in monogamous relationships, we kept seeing like, you're in a monogamous relationship, but you keep getting this BV. Is there
Okay.
something going on like between the partner?
Okay.
So now they've done a study. It was actually a randomized control study,
Okay.
and they looked at treatment of just the female versus treatment of the female and their partner. And what they found was the recurrent BV rate went way down if you treated the partner too.
How do you treat the
So
partner?
basically, we get the metronidazole.
Okay.
And so the partner also gets metronidazole, but now it's recommended metronidazole pills plus a topical cream.
Thank God, I thought you were going to say the guy had to stick the metronidazole in his
I
butt.
wish something.
I was just
men had to go through something.
joking about that, but
I wish men had to go through something, right? Because men don't go through.
yeah, we do have.
They
it pretty
even
easy.
took away rectal exams now, for the prostate.
Yes, I'm
like,
very, very happy
Can
about
we
that.
give you something? We get mammograms, our boobs get squeezed.
Yeah,
we
that's
have
true.
vaginal. That's not fun.
It's not fun, yeah.
For ladies.
I actually picked my primary care physician by looking at the size of their fingers because I thought that since I was getting older, that this was going to happen. But happily,
Joke's on you.
yeah, happy to report that apparently we don't need to do digital rectal exams anymore.
Yes, everybody's happy.
Yeah, so I'm very happy about
Except
that.
the ladies. I'm like,
No, I'm
you
just joking.
Can you give the men something
Yeah,
that's uncomfortable? There's nothing. Even the chlamydia now, remember? Like they got to stick a Q-tip
Oh,
way back
God,
when.
Yes.
But now it's just the shishi test, right? So it's like, anyway. But yeah, so recurrent partner, recurrent Concurrent sexual partner therapy is now a thing. Wow. So if your partner and you notice your partner keeps getting BV, it's a good idea for your partners
to be treated
as well. So it's a topical cream for the men that you put on the penis twice a day, and then it's a metronidazole pill.
That's kind of interesting because then that means that this chemical compatibility kind of thing between people is kind of a real thing.
It's a real thing. Right? And I've seen patients who have had recurrent BV or recurrent yeast infections with the same partner, and then they have a different partner, and then
because maybe the whatever the pH or whatever the bacterial flora on each individual person either jives or doesn't
jive. Yeah.
Right? That's really interesting.
I wonder, right? Maybe it's the universe telling
you that maybe not such a good idea.
Good idea.
Yeah.
Or, you just got to work harder for that person.
I guess.
Okay, so the second other type of vaginitis we're going to talk about is trichomoniasis, and so we call it trick. This is a STD.
Okay.
Yeah. So this one
so
is
this can be acquired by performing tricks.
Yes.
Yeah. So
yes, I think there's some vernacular out there.
But we should put the name of this on there because the trick that you're talking about is TRICH,
not
Trichomoniasis, right?
Yeah. So it's a protozoan species that actually infects us, and it's the most common non-viral STD in the United States. Okay. This, if you have more partners or lower socioeconomic status or douching, those are all risk factors for trick. Most people, half of them are asymptomatic and half have this like weird discharge that's going on. Sometimes you can have bleeding or abnormal bleeding or bleeding after sex. Trick. So of note, trick is kind of different. So usually, like chlamydia, if you have a STD, you come in, you kind of know who you got the chlamydia from, somebody who you just had intercourse with. Okay. Trick is different. It can be a long-term infection. So it's not like just because you tested positive for trick, that this is the partner that necessarily gave it to you. It can kind of stay in there for a while. Yeah. So it doesn't mean it's a newly acquired infection necessarily. Trick can kind of live there for a long time because you can be asymptomatic with it.
So you can be asymptomatic with it, and then like several months later,
months,
develop
you can develop symptoms, or sometimes we just do like a routine swab and it comes up, Yeah, very interesting stuff. This one you can have like maybe a green, yellow discharge, bubbly discharge. We do a swab to detect it. And again, its treatment is metronidazole again. This one, your partner, you should be tested with it 3 months after as well.
Okay.
And then let's talk about the last one is Candida or yeast.
Okay.
Yeast is very popular here in Hawaii, I would say. Because we have a warmer environment. People go swimming a lot in their bathing suits, go surfing, and so the pH of the vagina kind of can change with that.
So really a lot of these, like this Candida Candida and at least Bacterial Vaginitis really has a lot to do with the pH environment.
It does.
So again, because I'm assuming you have a little bit of Candida in your vagina anyway.
Probably, just on our skin.
But it's a
around.
small amount, right? And then when the pH changes to the point where the Candida can thrive.
Yeah. Well, yeast is a fungus. It's a fungal infection. But it likes warm, moist environments.
Yeah, but I would imagine you have to have some of it on you.
Probably, yeah. Like we probably have some yeast everywhere, right? Like even dogs in their ear, that kind of stuff. Yeah. So this is the second most common cause of vaginitis after BV. This one, everybody comes in with itching, usually. It can be asymptomatic, but usually women, when you get a yeast infection, because it is itchy and it's an itch you cannot scratch. It is up inside. It could be out on the outer side, on the outer vulva. It could be all over. It can also kind of infect your UTI and your urine too.
sorry, again, I'm getting embarrassed. I didn't really know this, but they said that yes, Candida is a normally found on and inside humans as part of the natural microbiome. So I think when your pH goes off and this can thrive, you get that. Okay.
Yeah. So this one, women, if you've ever had a yeast infection, you know out there, it's a white, clumpy, it looks like cottage cheese. And it's just a burning an itch that you can't scratch. And it is the most awful thing. There are creams and stuff over the counter that are available that are actually pretty good. There's a Monistat, which is a vaginal suppository.
Okay.
And there's different days that you can do like a 5-day, a 3-day, a 1-day. They are kind of expensive, so some people don't use them if they, because they're like 20-something bucks sometimes. Yeah. And usually we can give you a single pill at the OB office if you come on in. But, we'll do a swab again, diagnose it. This one also can be recurrent. Sometimes you can have recurrent infections, and we just give you like a weekly fluconazole for 3 to 6 months.
And this one, I think the other thing is that it's very common when you get antibiotics. Say you get treated with antibiotics for another reason.
Yep, because it messes up the bacteria.
Messes up the balance.
Yes.
Yeah, where it kills the bacteria, but then your fungus is free to...
But with that, all the good stuff goes away too, right? Yeah. So just the balance is anything that throws it off. But also with Candida specifically, it's very important you air her out. Make sure that you only have certain soaps that are like dye-free, fragrance-free. You want to use like cotton underwear or no underwear. Air her out, Yeah.
I see.
But it'll go away in a few days. But man, it is just the most uncomfortable thing ever for a lot of ladies. Men have no idea.
Well, men have jock itch.
Yeah.
Yeah.
But that ain't nothing.
I guess so, but
because it's not like on the inside, right? Like
true, but
it's
that
itchy,
is
but like
it can be quite sore.
Maybe to compare it, maybe it's like for you guys to have like an itch in your butt up inside that you can't scratch.
Oh, I see.
Yeah.
Yeah, I see. That's the difference. Yeah.
Like way up in there and you're like,
and again, getting back to please don't try to scratch it with this.
Don't scratch it.
Yeah, don't scratch it with
this.
this.
But you guys don't have yeast in your butts. You guys have nothing. You guys are jock itch.
Yeah.
Anyway, so a lot of yeast infection has to do with hygiene. So keeping everything clean. Like if you're going surfing, if you're going to the beach, just change out of your wet stuff as soon as you can, dye-free things.
Do you guys recommend, I've seen lately, and I haven't really looked into this, but I've seen things where they say that, women should sleep without underwear.
I've seen that.
I'm guessing it's sort of that way.
I would just suggest anything breathable, so cotton is actually the best. But, if you're going to wear a thong, it's kind of like going without underwears. If you're going to go with like those really like silky things or people wear a lot of lycra. Or like the spandex, that kind.
Yoga pants.
Yoga pants, those kind of jeans, those kinds of things really kind of keep all that in. And like I said, it likes warm, moist environments.
So what you're saying is that thongs and such like things are actually highly recommended.
I wouldn't give out that medical advice, but cotton. Actually, you know what? I gotta say, the most recommended thing is the granny panty with cotton. I'm sorry to say it, but she breathes.
I see, but I still think that probably. Most men would be very, very supportive of the thong idea. Yeah. Just because.
I mean, there's certain women that it's
for
great
safety, though. For safety and for your health. This is what it should be for your health.
I recommend the granny panty.
Men
that is what I
health,
recommend.
Okay?
The biggest granny panty you can find, ladies.
Okay.
Yeah. Anyway, that leads to our questions.
Okay.
The 10 things I'm too embarrassed to ask my OB. And one of the most common questions I get is my vaginal odor normal? Or even vaginal discharge, is it normal? I have people come in, I have discharge, is that normal? Yes, very normal. But what is normal for you, if you go outside, what is normal for you, if you have anything stinky, anything smelly, anything itchy, anything that's way different color that's different for you, then I always say it's probably a good idea to come in and check.
Okay. So actually, would you say most healthy vajayjays
Yes.
don't have really a strong odor or should not have a strong odor?
It can have an odor.
Yeah, but
just like our bodies, our bodies have like.
So again, you gotta know.
It's not like a BO odor,
Yeah.
but it can kind of have a little smell, but not crazy.
You would have to be, I guess so. The point is everybody's a little different and you would have to know that there was a change.
Yes, from what is normal. Yes.
Yeah, got it.
Yes. And even from like when you're a teen to 20s to 30s to 40s, that discharge can change. Like the amount can change.
That makes sense because of the hormonal changes that occur with your body.
The smell can change a little bit, but you'll know when the smell is not okay.
Yeah.
That's what I tell everybody. I'm like, if it smells like fish, usually that's not how somebody normally smells,
I don't recall this, but does Candida have a strong odor?
It doesn't.
It doesn't, right?
No, not to me. It doesn't smell very strong.
Yeah. The bacterial one's very, very, the bacterial.
The BVU can tell.
Yeah.
Yeah.
Those you can almost smell from across the room.
And don't be embarrassed. When you come in, OBs, we're used to it. We don't mind it. We like you to come in. We like you to check. Yeah. Usually, though, the yeast is more just the cottage cheese discharge and itching.
Yeah.
Those are the two kind of number one things we see.
Yeah.
Mm-hmm. Yeah.
And I guess if you're embarrassed, if you're in the waiting room and the odor is very strong, nobody knows where it's coming from. So you can always look at the person next to you and go like this.
Usually, though, the good news is you cannot smell it through your pants.
Oh,
usually.
That's good. Okay, that's good.
Usually, you have to kind of be...
Got it.
Bottoms down to kind of smell anything or see it, Yeah, I've never really had anybody that said, maybe here or there, but...
Yeah.
And it can usually... Sometimes I have patients that get BV or things like that before their periods, so it's kind of hard to tell if I have... a smell from my discharge or a smell from my period. So that also we kind of will check out.
Can the BV actually self-correct? Like
yes.
Let's say you're about to have
you don't always need...
You might have to have say you're about to have your period and your hormones are changing and whatever, pH changes a little bit. You get it for a little while, and then once your hormonal
or your flora gets back into
balance, it goes away on its own.
I've seen that too.
Okay.
So some people would say, "Oh, last month I had this fishy odor. I had like weird discharge, and then it went away." Like, okay, because you know what? Self-cleaning oven again, right? We keep it. Our girls are smart down there.
Yeah. So this is maybe another stupid question, but I've heard that washing down there, like with a douche or something, is not healthy.
It is not healthy.
Okay, I think that's important.
Thank you for bringing that up, because our kind of mom generation, that was very popular in like the older generation.
What is it called? Summer's Eve or something like that,
Summer's Eve.
It was like some kind of
a douche.
A douche, right?
And basically what a douche is you put kind of water up or some substance up to flush it. Some people use vinegar. Yeah. But again...
You're damaging the normal flora.
Yes. So it's not helpful to douche or to try to do those things on your own. And if it self-corrects, great. But if not, always go and see your OBGYN. And we can take care of that right away. Okay. Yes. There are some other questions that people had I don't know if you wanted to. Are they kind of similar to the ones that you've heard?
Yes, I've heard. So looks like another real common question is, does my vagina look normal? Is my labia and my vagina
normal
looking?
Yeah. And I would say we see a lot all day long. Okay. And usually everybody is really normal. If it's abnormal, your OBGYN will definitely say something. But
what would be like... If it, as far as just the looks, what
I don't know. Some people are just, especially the younger girls, when you just start kind of, I feel like we're really unaware of our bodies and not taught a lot about our bodies.
So here's another thing that I also read was that how your privates look like when you're younger will change based on the hormonal levels of, so like when you become reproductive.
Like your labia changes.
It gets bigger or something, right?
Yes.
Or it changes. And then when you go through perimenopause or menopause.
There's obliteration of that. Yeah, it's very interesting. So your vagina literally changes. So when you're young, though, I get these questions a lot. Like, does it look normal? When you're kind of around your like sexual debut time, people are wondering, like, am I okay? Or does it look all right?
And I've also heard that, people having cosmetic surgery to remove, like, I guess some people,
the labia is
minora.
large.
Is it the minora that sticks out? Like,
it could be either. Like, it could be that portion. It kind of, you could either have an asymmetric growth.
Yes.
Or it could just be larger. And I've had patients come in where they want a labioplasty because it is large, either after kids or just the way God made you.
Yeah.
And so one side actually causes pain and friction, when you walk or sit. So that's one reason why we would do a labioplasty. Kind of looks like extra teriyaki one side.
Yeah, so you know how people joke about the roast beef, right?
Yeah.
It
kind of looks a little bit,
it does,
it can have a little extra.
But, and who does the labioplasty? OBs or plastic surgeons?
I do them, but
okay.
Usually it's the plastic surgeons because usually if you want a labioplasty, it's most times they want other procedures as well done.
Okay.
So it comes with like the mommy makeover where you get the tummy tuck or the
we'll actually have a plastic surgeon on one day who's already agreed to talk to us about about such things. Aging with grace and beauty, talking about mommy makeovers, etc.
Yeah.
So
but I would say to women out there,
stay tuned.
Stay tuned. I would say to women out there, I wouldn't worry too much about what it looks like necessarily. Men don't care. And then I would say if it causes you pain or discomfort, then definitely let us know.
Yeah, I would 100% agree.
Right? Like men, nobody's like,
oh, that's...
Right.
Yeah.
Yeah.
It's usually quite the opposite.
It really
reaction.
is.
So,
Mm-hmm.
Yeah, I don't know of any guy that, a hetero
that
guy,
inspects anything or...
Any of my friends or anybody that's ever said, oh, I saw it and then I didn't want to do it. Like, come on.
I mean, men don't care. And our parts are kind of more hidden than men, right? So men care, I guess, about that sort of thing. But women really... I don't think men... men care at all. Men care about what they look like more than what women...
Yeah, I don't think...
But they don't care about what women
I have never heard of a guy tell me that's a turn off.
No. And I've never heard of a woman say, like, he saw it and then...
And said no thanks.
Yeah, white men said no thanks.
No thanks, I didn't want pastrami sandwich today.
No, it never happens, girls. So you know what? She looks beautiful. She's good. Don't worry about it. If it's causing you pain, discomfort, let us know.
I think that's probably good advice about all of you.
What's that?
Meaning the whole of you. Women are so self-conscious. Like,
we are.
Women are so self-conscious about how they look.
But that's like a societal construct about,
No, but I think...
But people are also very mean.
But you know what the thing
days.
is? It's women are most hypercritical of women.
Yes.
Guys are... If you ask most guys...
They don't care,
Guys find
You're
a lot of... Yeah.
100% it's women going after women.
Women are the meanest to other women.
Yeah. Let's not do that, ladies.
Yeah.
Let's be nice.
Guys,
because we're all doing the struggle. All the ladies, we are struggling.
And there are guys that find, it's true. Beauty's in the eye of the beholder, right?
It really is. And there's a nut for every squirrel.
There is a nut for every squirrel.
Let me tell you.
That's a great saying.
That's what my dad says. Squirrel. There is a nut for every squirrel.
Yep.
So don't worry. If that's not your nut, there is another nut somewhere else.
I have a story. When I was working at this clinic, and this guy came in.
You was working there?
Yeah, I was working there. This guy came in.
Yeah.
He was homeless.
Oh.
Okay.
Okay.
He was like, not to be cruel, but he was obviously super dirty, right?
Yeah.
And then at the end of it, we were talking about treatment, and I said something to him.
Oh, he came in for something.
Yeah, I said something to him like, well, because, we knew you were homeless. We're like, well, after you have this procedure or whatever, you're going to need someplace safe to stay. Like, do you have...
And clean.
And clean.
Yeah.
I was like, can you, is there someplace or, do you have anybody? He goes, oh, I'll just stay at my girlfriend's house. And I was like...
Oh, yeah.
I was like, wait a minute. I was thinking to myself, I didn't say this, but I was like, you have a girlfriend?
Yeah.
Like, this guy literally smelled like...
Oh, no, they have... Yeah.
This guy smelled like pee and...
Oh, yeah. No, yeah.
And feces combined, like doo-doo. Like, like, he was nasty.
Yeah. No, there's a nut for every squirrel.
Yeah, so that's when I realized that,
Some people don't mind the hygiene thing.
Yeah, so but I guess I put things in perspective, and I was thinking to myself, you know what? I don't think I need to worry about, ever finding. I told my friends, don't ever worry about it. If this guy can find a girlfriend, you'll be just fine.
But it's hard to find a good man.
But it's true.
It's hard to find a good man.
It's true for women, though.
Men,
Yeah, men, yeah.
Yeah. Hard to train, too. Once you train one, like, you cannot, to retrain another one, it's hard.
It's very hard.
Yeah. That's why I just gonna stick with what I got. I mean, I love you. Anyway. What's the next question?
The next question is, should I shave before my visit?
Oh, yeah. Shaving is a fun one. So like the hair question, right?
Okay.
Like you don't need to shave before you visit.
Okay.
From what I hear to our parents' age, like when you gave birth, they used to shave you before they gave birth. Did you hear that?
No, I didn't know that.
Mom. I mean, that's a weird question to ask your mom. Maybe not. But like...
Well, my mom would tell me. But
my mom said they used to shave you before you gave birth.
Really?
Yeah, it's very interesting. But nowadays...
That was a practice before?
I don't know. That's what my mom said. Like everybody got shaved. But we don't do that anymore. And in fact, shaving causes like a lot of microabrasions and can cause infection, especially before surgery. So like C-sections and stuff, please don't shave before your C-section.
Yeah.
It increases your risk of surgical site infections.
Oh.
So that's why we use a clipper.
Yep.
But shaving is kind of funny because it does cause a lot of itching, like when the hair grows back.
Okay.
So that's one thing that people come in for vaginitis for, but it actually is, the hair growing back after I shave.
Okay.
But you can have a lot of itching.
Yeah.
Because it's real itchy.
Yeah, I would imagine.
Yeah. So we suggest either like wax. See all the things women go through.
Yes.
I'm telling you.
I know.
We suggest either waxing or laser hair removal, but you don't have to do anything at all before you come in.
For your doctor's visit.
For your
right?
doctor's visit. No, don't worry about it.
Because you guys have seen it all.
We've seen it all.
Yeah.
And people are so embarrassed, which I understand.
Yeah.
But at the end of the day, we've seen it all. And there's no surprises. Okay. Rarely, I don't think you could surprise me with much these days.
Okay. Well, what if somebody came and asked the question, how much masturbation is too much masturbation?
Oh, well, when it affects like your quality of life, I would say that's too much. Like you got to go to work and you got to do it appropriate places.
Yeah. Is this common among women?
Masturbation?
Yeah.
Yeah. Just like men.
Oh. So it's a hobby.
A hobby for men?
I'm just going to say.
I don't know about men. But
it's
women,
a hobby.
Sure. Women, it is very common. And it's very normal. Let's normalize our bodies. Let's normalize it.
I would be willing to bet $1,000 that men will beat women.
100%.
Yeah.
I mean, we got things to do. You know.
Yeah, men.
We got places to be.
It's
we cannot be
hobby.
doing that all day. But I mean,
Yeah.
Yeah. It's healthy. And it's normal.
It is normal.
So,
So this is a really interesting one that I found on the internet.
Oh, it's
what can I do? So here's another, it's an embarrassing question, right? What can I do about embarrassing noises like a vaginal fart, like queefing, during sex or yoga?
Okay, during sex, like we just said, I don't think anybody cares.
Nobody cares. That's true.
And there's a lot of noises going on.
It's True.
So I don't think your partner, if they're male,
they don't care.
Cares very much.
Yeah, they don't care.
And if you have a female partner, they know what's going on. So it's what
true.
it is.
It's true.
And it's not going to ruin the moment.
But what about yoga? Can you
Yeah.
imagine being in yoga?
Well, okay. Can I just be honest?
Yeah.
Nothing against the yoga people. I mean, I love the yoga people, but they're very natural usually. So I've been in
True.
yoga classes where people rip one
Yeah.
without any shame.
Well, I guess that's
And
true,
nobody
right?
cares there.
Yeah, and all you got to do is do a om, and then you're good.
But don't you find they're more natural, like the yoga people?
True. I think
So
they're
I
very
feel
into
like
holistic
better
approach
out than in idea.
to living. So that's a good point, actually.
I just feel like I've been in yoga classes and I didn't know how to react, right?
Yeah.
But there were people who just let it go. And nobody reacted. And I was the only one going,
Yeah. Maybe this is why guys don't go to yoga too much, because if that happened, they would be cracking up.
you know what's the worst though? When you rip one in hot yoga. You know, like when you fart in the shower, more stink. I don't know why.
Is that true?
What? You never. When you fart in the shower, it's more stink.
Maybe.
Have you ever done it? You should try it.
I'm sure I know, but I don't know if I ever noticed if it's.
I don't know. Am I crazy? I feel
I
like
don't know.
it stinks
No,
more.
but you know what though? Maybe because
in
you're
the
in
shower.
maybe because you're in an enclosed hot environment. Yeah,
Maybe.
you know what I mean?
Which is hot yoga. Like
Yeah.
when people fart in there,
Yeah. Oh man.
it's rough. But you know, I mean, God bless, to each his own. I no judge,
Yeah.
no judgment zone.
Do you have to just keep
Kind of.
repeating in your head, "Namaste, Namaste"?
I'm like trying hard. I don't go there usually.
Wow.
But yeah.
Okay.
Yeah. But yeah, that's my.
What other questions have people
Really, you
have
never
asked?
farted in the shower?
No,
What is this more stink?
I'm sure, but it stinks all the time. So,
but not more stink.
I have no idea.
It's like chambered.
I have no idea. Maybe it is. It's because you're in an enclosed
Maybe
space.
I'm
right?
crazy.
No, it's probably because you're in an enclosed space, I'm guessing.
You think so? And you
Probably.
smell it more.
Maybe because maybe the heat makes it rise faster.
Oh, maybe
too.
that's what it is.
Yeah. So it
Bring that
rises
science in.
rising in a more concentrated fashion, right? Right? I'm
Maybe.
guessing maybe.
I don't know. You try it. You let me know. Yeah. But now you're gonna be like,
I never thought about that. But yeah. Okay. What other questions did you have?
I don't know what else I got on there.
You look
What
at
else
them.
I got on there?
We went over the vaginal discharge thing.
Yeah. So discharge is done, I think. Oh, okay. Should I shower before I come in? I say no. No need shower. I mean, we appreciate, but no need.
Yeah.
What I
'cause
say is we smell the feet more than the vagina.
that's a very you and I were talking about this before. Could you please
Well, like the vagina's a little bit farther away from us when we're doing our exam. What's near our face and our head is your feet. So, I mean, you can keep your shoes on, you can take your shoes off. We don't care. We clean it every time. But, that's what we smell more than,
really?
I don't know. That's what I reckon.
Yeah, that's
For
very
men out
interesting.
there, because my husband didn't know this before I had children.
Yeah.
Because you guys don't come to the OB visit with us. On the exam table, there are things called stirrups.
Yes.
And so these things pull out of the exam table, flip out, and that's where ladies put their feet.
Yeah.
And then your bottom is at the bottom of the bed.
Yeah.
So that's kind of the picture of what
I think
an exam is.
all women who have gone to the OB know about this.
Yes,
Obviously, yeah.
but men, I didn't realize because when they pulled that out and I was, checking for when I was pregnant,
Yeah.
my husband came in, first time ever, and he was like, "What are those?" And I didn't realize
that he never saw one. Yeah,
men
yeah.
would never see it, right?
Yeah. Unless you're in the exactly.
Yeah.
Unless you go to the appointment.
Appointments.
And I think that's kind of I don't know if anybody really why would a guy, because you can't stand there while your girlfriend is having an exam. It's weird, right?
There are some partners that would like to be present. In our clinic, we allow partners if you're pregnant or post-surgical.
Yeah, but if you're
But
like just
an
doing
annual visit, we
Yeah.
don't really necessarily.
because you have to talk about things that
Yeah.
you may not want the other person to be around for.
Very true.
Yeah.
Yeah.
So
Yeah. And then I always get the question, should I come in if I'm on my period?
yeah.
And that's okay. You can come on in. It kind of depends on how heavy. If the flow is like really strong and going, maybe not. But like we don't mind it. You can come in on your period. It's okay.
What about, this is another question that I got was, is it possible to lose a tampon?
Oh, that's a good question.
In your,
It is not like in your belly. Like it just goes somewhere and like lost forever.
I guess that's what they mean by this.
But the vagina is a closed kind of system. So what you have is you're outside, right? And then you have the vagina, and then you have the cervix, which is the opening to the womb. That's where a baby would be if you were pregnant.
We should show a graphic on this.
We should. Yeah. So the cervix stops anything from getting lost in the Neverland.
But
you can lose one and forget. I've had a lot of people with retained tampons.
Yeah, and actually it can lead to something that's quite toxic.
Shock.
Yeah, so and that is probably one of the most
scary.
Yeah,
Scary.
mean, women that have that, they're like close to death.
Death, because you get septic.
Yes.
Like deathly septic from tampons.
But how does one forget that you...
Sometimes it's just you can't remember if you took the last one out and you just put another one in and keep changing that one. That's a common story I get. Another one is I was drinking and I had my period and I thought I took my tampon out and they didn't.
Oh. But wouldn't they feel it?
No, there's not many nerve endings up in the upper cervical region in the vagina. There's not a lot of nerve endings. So that's why I tell people, if you can feel the tampon, it's probably in the wrong place. Because usually when you stick a tampon up there, you don't really feel it. But you feel it like if it comes out or when you put it in. But you don't feel it up there. There's not a lot of nerve endings. So that's why people can use like Diva cups. Have you heard of that?
Is that the birth control?
No, it's like a cup. Instead of a tampon, you put like a little cup up inside to catch the blood.
Oh.
And then you take the cup out, wash it, and you can put it back up inside. So that's called the Diva cup. Yeah.
That works?
It's for people who don't really want to use a tampon.
It doesn't leak around the sides?
I don't know. I'm not really like super familiar with the Diva cup, but usually my patients that use it say it doesn't leak. It's very easy. They just pop the seal, pull down, and then wash it. Yeah.
It's interesting.
Yeah, so that's the newest one is the Diva cup for the periods. People also use nothing, right? Like they have that period panty now that catches.
Period panty?
Yeah, so you don't have to wear a pad or anything. Apparently, like
it's like a disposable panty?
It's washable.
Oh wow! So these are for probably the yoga people.
Yeah.
Yeah, very natural.
Very natural.
All natural.
But yeah, so tampons and anything in the vagina, unlike the butt, usually cannot get lost up inside unless you perforate it somehow. But it can. Some vaginas are longer and harder to get things out, so that can be a problem. But I always say if you really need to, you can get the help of your partner. But it might get a little, go a little sideways because men just say, oh,
This is another question that how long, like when you put in a tampon, how long do you keep it in there?
Well, different ladies have different amounts of flow and then different,
that makes sense.
But we say it should be changed at least every 6-ish hours.
Oh, that frequently? I thought it was like once a day.
No, 6 to 8 hours. Like we don't want you to leave that tampon in for very long. Like
I didn't realize. I thought it was like a 24-hour thing.
Usually if you're not on your light day, like you're changing it kind of more often, right? And some people are very they just are very regular with changing it out. But some people have such a very light flow that they just leave it in. And then sometimes you can just forget about it. Yeah. But you don't want to leave it in there for extended periods of time,
What other embarrassing questions or things that, what other embarrassing things have you actually seen?
I mean, I've had a lot of people who are embarrassed by a lot of stuff. I'm not embarrassed. There's no judgment zone. If you have anything that you think is embarrassing, you can always ask.
Yeah, I don't think doctors that are in that go into urology or OBGYN are embarrassed by much.
And I tell my patients
it's the nature of the business.
It's the nature. And I tell my patients, there's nothing that you can be embarrassed about. I talk about sex all day.
Yeah.
Every day. And there's nothing that I haven't been asked before.
Yeah.
You know? So there's nothing really on the embarrassing scale that's too embarrassing to ask your OB. And I'm sure every OB out there is the same way, you know?
Yeah. And I guess after all, if you are their doctor, they should feel comfortable to ask you whatever.
Right? But you know, I get it. We only see you once a year usually.
Sure.
If you have a few problems here or there, it's kind of awkward to talk about with a stranger. Or if you're young, you know, and kind of unfamiliar with your body,
I guess
it can be a little bit daunting. But there's no judgment, no embarrassment. Come on in, ask away. I did sex ed though at a few of the schools. I used to go around doing sex
really?
ed. Yeah, that was shocking. Those kids have some questions.
Where did you do sex education at?
Can I say which schools? They were private schools.
Oh, okay.
Because you can't do publics, Public school.
I see.
Mm-hmm.
I see. Well, I'm just curious what kind of questions. Yeah, I'm sure
I don't know
you
if I could say those questions on air.
Really?
Yeah, I'll tell you
why
later.
Not?
I don't think you can say those things.
Like, I really want to know.
I don't think I can say those things.
Like, I can't imagine what you. This is a.
Can you bleep me out?
I can.
Yeah.
If it's like medically related, I think it.
It's okay. I don't think we're talking about.
No, I don't think I can say it. But anyway, it has to do with like donkey punches.
Donkey punches? What's a donkey punch?
Right? And dirty Sanchez's.
They asked.
I didn't know.
Yes.
Wait.
Oh my God.
Wait,
No, like those things. I was like,
Wait a minute. What is a donkey punch?
I had to call Kleiner, and I was like,
Everybody else in the room.
can you bleep this out though later? Okay.
Wait. If I think it's what is a donkey punch?
I know.
So they were like, hey, miss, you know, right when we was having sex the other day. And I was like, how old are you? And he was like, oh, I'm 16, you know, and me and my girlfriend. I was like, bruh, they're like very, anyway. So he was like, so what? Is it okay, like, if I donkey punch my girlfriend? And I was like, what is that?
Yeah.
He was like, you know what donkey punch is? I'm like, no. He's like, you literally, right, I can't even say, you literally, when she's about to come, you punch her in the face.
What?
Why?
I don't know. I have no idea. It's like a thing that they donkey punch each other. Why do they call it donkey? I don't even know. It's a donkey punch.
That is.
It's not. It is not. I think it's like
I
the
didn't know that was
SNF.
bad. I thought a donkey punch was you just punch him in the stomach.
Oh, you can. The girl punches the guy, or the guy punches the girl. Right when you're about to. Boop.
Why in the world?
To each his own, yeah.
To each his own.
Or the dirt.
Tell him what a dirty Sanchez is.
I know what. I think I know what that is.
Give a little tickle in their pickle, and then you put it over the girl's lip.
Wait, what?
You know,
I think I know what that is.
put the doo-doo.
Yeah, that's what I thought.
Make one mustache, yeah?
Yes.
One dirty Sanchez.
Yeah.
Rusty trombone.
Oh, what was that again? Kleiner and I were talking about the rusty
Wait,
trombone. What is that one again?
What is that?
Philadelphia steamroller.
Oh my God.
Wait. What is a?
Hey, what did teach you in Kauai? I know it. I know.
Wait a minute.
The rusty trombone.
What is a rusty trombone?
These are so new. It's been such a long time.
It's a long one. It's a long time. Yeah. No, there's all kind of. I'm telling you. But
Wait,
anyway, kids got questions. Okay.
Yeah, but what? No, I gotta look. I gotta find out.
Look them up. Look 'em up.
What? It's a rusty trombone and what?
Philadelphia steamroller.
Philadelphia steamroller.
I'm telling you, Cass. These kids nowadays. But you know, I always tell them there's nothing embarrassing. And my face when they asked me about the donkey punch, I was like, "What? Yeah." Mm-hmm. And they're asking these questions in class, like.
All I know is that the Philadelphia steamroller does not have a recognized medical meaning and does not appear in reputable medical or scientific references.
Not reputable, no.
Yeah. So I'm guessing I'll never find that term in the New England Journal of Medicine.
We know people in low places, K-Cass. He found it.
Yeah. Prostate orgasm? That is an interesting way to say it.
I mean, these kids, but I don't know how the kids know about this, right? Like how,
Where do they find it?
I don't know. Maybe I'm old school, but I don't know these terms, you know? But the donkey punch one, that one got me. I was like, bruh, don't be doing that.
Yeah.
You're going to get single real fast.
Oh, so it's
But you cannot have that face when you're talking to the kids, right? You have to be like,
True.
oh,
very professional.
yeah, please don't punch somebody when you're going to orgasm.
What did you say? It was a dirty trombone? What was it?
Rusty.
Rusty.
Look it up on Urban Dictionary.
One rusty trombone. I remember I had to ask your brother about the rusty trombone and the donkey punch. I was shocked. Mm-hmm. Don't look up images. Yeah,
No,
this account will be flagged.
There's a drawing. Oh my god. Is this what teenagers are making their girlfriends do?
Yeah. I mean, and then you got the normal tea bagging and, you know, the normal stuff. But like, yeah, I think it's a game with them, though, to try to make me.
To visually.
Yeah, I think it's just like they all had those, but like 6 or 7 of them all asking me about these things.
It's gonna make her laugh or like.
Yeah, I think so, right? Like maybe embarrassed. I'm like, come on, get better than that, dirty Sanchez, donkey punch. Come on. So yeah.
Well, I learned 2 new things today.
You did.
Yes.
And you can use those.
Yes.
You can use those.
Yes. Actually, 3 new things today.
3.
Yep.
Oh,
I
yes.
learned what a donkey punch is.
Yeah.
A rusty trombone. And Philadelphia steamroller. Okay.
Yeah. And a dirty Sanchez.
Yeah, I guess everyone in the audience can look that up on the Urban Dictionary to find out for themselves what exactly those things mean.
Again, let's add that to please don't do this.
But I guess the rusty trombone is not dangerous. Except it's maybe not so hygienic, but
it's not hygienic. That's
Yeah.
the problem, right? Nobody wants E. coli anywhere.
true.
So I'm just saying, like the dirty Sanchez, nobody needs that. Don't put that by your mouth.
That's
Don't put
true.
that. Don't put that anywhere. Nobody needs.
That's true.
To get septic from E. coli.
I can't imagine there's a physician out there that would recommend or say that this is safe to do.
And intimate partner violence is never the answer. Okay.
Yes.
I mean,
Unless
you gotta have a good safe word.
what? That's crazy.
Yes. Anyway, I don't know how Ryan's gonna edit this, but this, yeah.
Well, I think that's a
Anyway.
good place to end our
I
segment.
feel that is too.
On
I hope
the,
that was very educational today.
on the most embarrassing or questions that you're too embarrassed to ask your OB.
Yeah. And vaginitis.
And vaginitis. And with that, we ask you to like and subscribe. I guess it helps the algorithm.
Yeah.
You can leave comments for us, but because we are new
I
at
don't think
this,
people should.
yeah. But you can.
I don't know if that's a good
And if
idea.
you do have questions, we will try to look them up and address them, maybe at some later episodes. But again, Dr. Lehua and I are new to this.
We're very new.
This media thing.
Yes.
So we're trying to figure out how to get to your questions and comments and how to address those, etc.
And readdress things.
Yes.
Yeah. But we'll figure it out.
Yes,
Yeah,
and please,
together.
yeah.
Keep watching.
But I do think today's episode was we did give some good solid advice of
I think so.
of what not to do.
Of what not to do.
Yeah.
Or just be careful.
Or just be careful.
Be careful out there.
Be careful out there.
It's a rough world.
Don't hurt each other. And
Don't hurt each other.
And don't hurt yourself.
Yeah. Love each other.
Don't harm yourself.
Don't harm yourself for others. That's pretty
Yes.
much the
Yes.
basis of what we
Yes.
had to say today.
Yes.
Yeah. So please subscribe.
Yes. And thank you for joining us
Thank
again
you.
on From the Inside Out.
Take care of each other.